Addison's disease, or primary adrenal insufficiency, is a rare but critical endocrine disorder every nursing student must know for the NCLEX. It results from the adrenal glands failing to produce enough cortisol and aldosterone, hormones essential for stress response, blood pressure, and electrolyte balance. Recognizing Addison's is about patient safety. You'll need to spot early signs, interpret labs, and act fast in emergencies like Addisonian crisis. For the NCLEX, remember Addison's means low sodium, high potassium, and lifelong hormone replacement, key differences from Cushing's syndrome. Addison's disease primarily affects the adrenal cortex, the outer layer of the adrenal glands. These glands, small but mighty, sit atop your kidneys and are responsible for producing several essential hormones. The adrenal cortex normally produces cortisol, a vital hormone involved in numerous bodily functions. Think of cortisol as your body's natural alarm system preparing you to handle stress. It also produces aldosterone, another key hormone. And finally, the adrenal cortex is responsible for producing a small amount of androgens, sex hormones that play a role in both male and female physiology. Cortisol is essential for managing stress, regulating metabolism to provide energy, and controlling inflammation throughout the body. It also plays a role in immune response. Aldosterone is crucial for maintaining electrolyte balance, specifically controlling sodium, potassium, and water balance within the body's intricate fluid systems. In Addison's disease, the adrenal cortex suffers damage, often due to an autoimmune response where the body mistakenly attacks its own tissues. This damage impairs the adrenal cortex's ability to function properly, causing a sharp and significant drop in the production of both cortisol and aldosterone hormones. Without sufficient cortisol, the body loses its ability to effectively handle stress, and it struggles to regulate blood sugar levels, leading to problems with glucose metabolism. This hormonal imbalance manifests as persistent fatigue and overall weakness. With low aldosterone levels, the kidneys are unable to retain sodium, leading to excessive sodium loss in the urine. This sodium loss results in dehydration as the body loses vital fluids. Dehydration contributes to low blood pressure, a condition known as hypotension. Simultaneously, the body struggles to excrete potassium, leading to high potassium levels in the blood, a dangerous situation that can disrupt the heart's rhythm. The result is a perfect storm of debilitating symptoms and overall physiological instability, potentially leading to a life-threatening adrenal crisis. Understanding this breakdown of adrenal function and its consequences is crucial for providing safe and effective nursing care and achieving success on the NCLEX exam. The most common cause of Addison's disease, a condition where the adrenal glands don't produce enough hormones, is autoimmune destruction. This means the body's own defense system mistakenly targets and attacks healthy adrenal tissue. In these cases, the immune system attacks the adrenal cortex, the outer layer of the adrenal glands, until it can't produce essential hormones like cortisol and aldosterone. This process can take time, developing slowly over months. However, autoimmune destruction isn't the only culprit. Infections like tuberculosis, severe sepsis, specifically Waterhouse-Friderichsen syndrome, a life-threatening condition associated with adrenal gland failure, and certain fungal or HIV infections can also directly damage and destroy the adrenal glands, impairing their function. Cancer may spread to the adrenals from other parts of the body, a process known as metastasis, disrupting hormone production by physically damaging the glands and interfering with their normal function. Rarely, genetic disorders affecting adrenal development or function, or certain medications, particularly those that inhibit adrenal hormone synthesis, can impair adrenal function. It's important to distinguish primary adrenal insufficiency, also known as Addison's disease, from secondary adrenal insufficiency, which results from pituitary gland failure leading to decreased ACTH production or abrupt steroid withdrawal after prolonged use, suppressing the adrenal gland's natural hormone production. For NCLEX exam preparation, it's crucial to know the risk factors associated with each cause of Addison's disease. Understand that symptoms of Addison's disease often appear only after a significant portion, typically around 90%, of the adrenal cortex is destroyed. Recognizing the underlying cause of Addison's disease is essential, as it guides both the diagnostic approach and the subsequent management strategies for the patient. Diagnosis starts with recognizing persistent fatigue, muscle weakness, and weight loss. Key labs: low sodium, high potassium and low blood sugar, direct results of hormone deficiency. Morning cortisol is low, ACTH is high in primary Addisons. The ACTH stimulation test confirms diagnosis. No cortisol rise after synthetic ACTH means adrenal failure. Further tests, autoantibodies imaging, help find the cause, like autoimmune disease or tumors. For NCLEX, connect symptoms to labs and know the ACTH stimulation test is definitive. Early recognition and testing are vital for patient safety. Identifying the cause shapes long-term care. Addison symptoms develop slowly. Think chronic fatigue, muscle weakness, weight loss, and GI issues like nausea and abdominal pain. A hallmark skin hyperpigmentation, especially in creases, scars, and gums due to high ACTH. Hypotension and salt craving are classic, as the body loses sodium. Watch for orthostatic hypotension, dizziness or fainting when standing. The most severe form is Addisonian crisis, sudden pain, shock, severe vomiting and confusion, an emergency needing immediate action. Recognizing these signs is key for NCLEX and real-world nursing. Addisonian crisis is a life-threatening emergency. Profound hypotension, shock, severe vomiting, and mental status changes. Triggers include infection, trauma, surgery, or abrupt steroid withdrawal. The body can't compensate. Low cortisol and aldosterone cause rapid fluid loss, low blood sugar, and dangerous potassium levels. Without immediate treatment, cardiovascular collapse and death can occur. Nurses must act fast, recognize crises, start emergency interventions, and monitor closely. Long-term, patients risk fatigue, other autoimmune diseases, and cardiac issues if not managed well. Prevention and education are as important as emergency care. Lifelong hormone replacement therapy is often a necessary component of managing adrenal insufficiency. It's a commitment to maintaining hormonal balance and overall well-being. Hormone replacement is the cornerstone, the very foundation of treatment for primary adrenal insufficiency. Without it, the body simply cannot function properly. Typically, this involves hydrocortisone for cortisol replacement, mimicking the body's natural cortisol production, and fludrocortisone for aldosterone, which helps regulate sodium and potassium levels. Doses are carefully tailored to each individual's needs and may need to increase during times of stress, illness, or injury. Regular monitoring and adjustments are crucial for optimal health. This adjustment is often referred to as stress dosing, and it's a critical skill for patients to learn. Stress dosing is a proactive measure taken to prevent adrenal crisis, a life-threatening condition that can occur when the body doesn't have enough cortisol. Patient education is absolutely vital. Individuals need to understand their condition, their medications, and how to respond in emergency situations. This includes understanding stress dosing protocols, maintaining strict medication adherence, and recognizing the signs and symptoms of both under and over replacement. It's also essential to wear a medical alert bracelet or carry identification that clearly states their condition and medication requirements. In the event of a crisis, immediate intervention is necessary. This typically involves IV hydrocortisone and fluids to stabilize the patient. Normal saline is administered to address dehydration, and dextrose may be added if the patient is hypoglycemic. These interventions are top priorities in managing an adrenal crisis. Rapid response can significantly improve outcomes. Continuous monitoring of vital signs, electrolyte levels, and cardiac rhythm is crucial to assess the patient's response to treatment and identify any complications. For example, hyperkalemia or high potassium levels can lead to dangerous cardiac arrhythmias. It's also important to identify and treat any underlying triggers that may have precipitated the crisis, such as an infection. For those preparing for the NCLEX exam, remember these key principles of adrenal insufficiency management. Prompt administration of IV steroids, IV fluids, and close patient monitoring are essential components of successful treatment. These interventions can truly save lives in the face of an adrenal crisis. Ultimately, the goal is to empower patients to actively manage their condition and advocate for their own health. This includes educating them to recognize early warning signs of adrenal insufficiency and seek prompt medical attention when needed. Effective nursing care plays a crucial role in preventing adrenal crises, promoting patient well-being, and ultimately improving their overall quality of life.